afternoon, everyone, and welcome to today's Public Health Ontario Learning Exchange on community data governance, from learning to practice. My name is Tahira Walji. I use she, her pronouns, and I'm a senior program specialist in health equity at Public Health Ontario. I have the pleasure of moderating today's session. Before we begin today's session, I wanted to start from a place of gratitude for being part of this learning exchange today with some amazing speakers who I'll be introducing to you shortly. I'm also grateful for joining today's conversation from Treaty 13 territory, covering Tkaronto, the traditional lands and territories of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. I'm also grateful to be able to work, learn, unlearn, and live on these lands. We also recognize the enduring presence of many diverse First Nations, Inuit, and Métis people across the regions to which this webinar is being delivered. Acknowledging traditional Indigenous territory is one way to affirm Indigenous presence and land rights. We must continue to be guided by Indigenous communities, including the recommendations of the Truth and Reconciliation Commission. For more information on the purpose of land acknowledgements, check out native-land.ca. It is now my pleasure to introduce the speakers for today's presentation: Jamal Demika, Christian Daboud, Emily Ackerman, and Roxanne Gillis. Jamal Demika is a researcher joining us from today's Wellesley Institute. We also have Christian Daboud, Manager, Health Equity and Indigenous Reconciliation from Middlesex London Health Unit. We have a slight update to our speakers joining us today from the City of Toronto. Emily Ackerman will be presenting on behalf of Tinika Harrison Hansraj. Emily Ackerman is a consultant with the Equity Unit in the People's and Equity Division at the City of Toronto. We're also very happy to be joined by Roxanne Gillis, First Nations, Inuit, and Métis Data Governance Consultant at the Data for Equity Strategy team at City of Toronto. We're privileged to have Jamal, Emily, Roxanne, and Christian join us today. On the screen, you'll see the agenda for today's session. Our speakers today will share with us their reflections and learnings from their respective organizations on the central role of community data governance in the responsible collection and use of race-based data. Our speakers will highlight how community data governance and the use of frameworks have been applied in practice, and how this has led to communities' greater control over their data, particularly around how it is collected, analyzed, used, and accessed. This will be followed by a question and answer period between the speakers, the moderator, and the audience. We'll use the last few minutes to wrap up today's session. On the screen here, you'll see the learning objectives for today. We're hoping that by the end of the session, you'll be able to describe the role of community data governance as being central to the responsible collection and use of race-based data. You'll be able to describe some promising practices for engaging communities in data governance at the local public health level, and understand examples of meaningful collaborations with community to inform institutions' responsible collection and use of race-based data. We hope that regardless of where you are on your journey, that you're able to take something away from today's session. And I definitely think you will with this great panel we have lined up. So with that, I will pass it over to Jamal from the Wellesley Institute to start our first presentation.
Perfect. Hi, good afternoon, everyone. As mentioned, my name is Jamal Demika. I'm here from Wellesley Institute. Talk a bit about my perspective and some of the work that I've done here with community data governance. And part of what I want to go over today is, of course, explaining a bit about what it is and how, it's currently being understood, seeing the work that's happening across the health sector here in Ontario, trying to understand what implementation has looked like and kind of the future directions of this. A lot of people have drawn attention to the fact that race-based data has not been routinely collected here and the issues that come along with it. And at the same time, there are advocates who demonstrate that people are comfortable with this perhaps But there are a few stipulations that we need to talk about and concerns. One of which is currently when we talk about the way that data is managed and controlled, there's a large focus in our legislation on individual privacy, right? As a community and as a group, there really isn't much there currently. And there are, a history of how this data has been used and collected to the point where people have rightful concerns around people wanting more, right? What's going to happen with that? And the issue is, if we understand the role of this information and being able to drive, equity initiatives, we need to also think about, well, we need complete data sets, right? We need to make sure that there's a robust system in place so we can actually make accurate interpretations. And that requires then for us to go out and build trust with communities on this. And because if we don't, what's going to happen is we're not going to be able to make, get the data necessary to have the findings to create change. And very specific focus on Black communities that we have here is drawing attention to the way that there have been examples of how data has gone up to an institution and not come back in any meaningful way. In fact, sometimes you'll see an institution receive some type of reverence for the findings that they have, but the communities and then don't receive any benefit. There's also examples. Even as recently as COVID-19, where data has been collected and race-based data specifically. And then throughout the pandemic, there were some early conversations saying that perhaps Black communities who are experiencing a higher amount of COVID-19 transmissions, hospitalizations, and mortality, that it's due to a genetic or biological, cause. When in fact, that is not the case, and that's what many people were saying, but we quickly saw that happening right in front of our eyes just a couple of years ago. So this isn't some long historical thing that's hard that that we need to uncover. This is a current practice, on top of just seeing data monetized or used in harmful ways. And so again, if we know that we need this data, we need to then talk about what do we need to do in order to build trust. And that's where community governance comes in, and specifically the EGAP framework that was built. And I'll talk about this right now. So community data governance, it's this idea that then, data governance already is a thing and has been a thing for a while. It's usually now, well, the legislation says we have to put this in place, or, the industry standard is, privacy controls are set like this. And that's all well and good. But now if we're trying to understand, how do we insert the role of communities to then make decisions around their own data? Because if we're asking people to provide very valuable information, it only then makes sense for us to involve them, right, and center them in how that data is managed. So the EGAP framework speaks to, data sovereignty for Black communities and how they can have ownership over their collective information. And it walks through, these four tenets that are right here: engagement, governance, access, and protections. And maybe in the chat, if I drop a link about the Black Health Equity Working Group, and that's the group of people who, built this. We're a bunch of people in the health space here, and then also the EGAP framework as well, because there's a full report where everyone can read a bit more about what it actually looks like and entails, right? Engaging with communities so that we have, them involved and we understand what their needs are around governance, and building governance tables and having the conversations around access and protections. And then this came into, all right, this has been built 2021. Where do we go from here? And that's where the EGAP implementation guide idea came up. So on the Toronto region of Ontario Health, as part of their anti-racism strategic framework, they asked, who's willing to just try this? We need to see what this looks like in real life. And there were a few early adopters. So, hospital networks, community health centers, and Ontario health teams who said, we're willing to do this. We don't know what this is going to look like, but we have this framework that you guys built. Thank you so much for that work. We'll do the hard work. And so what we did as Wellesley is we followed them in their journeys. I went into all their meetings that we're having. We had a community practice, and everyone talked about the challenges and also the specific nuances that they had as a hospital, as an Ontario health team, as a community health center, and what they were able to do and what they couldn't do. And what we wanted to produce out of this was an implementation guide for other organizations to look at this and scale this up. as a region. And generally, there's this kind of guide that they started off with, which is one, getting some organizational agreement together to build some readiness. And so then they can enter the stage of community engagement, right? Actually go into communities, talk about data. And one thing I will say is that sometimes people think data is a very complex topic you can't talk to anyone about, but ask anyone on the street about what their thoughts are around data, and you can have a full conversation about. So there's engagement to be had around data. And then it gets to the point of governance tables, right? People are interested and they have thoughts about the data. Who wants to be involved? In which ways? What does that look like? You ask those questions, and then organically you're able to start building those tables so that you have a place to go to and say, is this a responsible use of race-based data, right? You gave us this information. We're scared. We don't know the balance between, doing the things that we need to do, but then also respecting privacy. Everyone talks about that tension and being afraid of making those decisions. Communities are right there, right? And so once you build those spaces, you can go ahead and make those decisions with a lot more comfort and ease. And then in order to make, decisions around data, you need to support access, to that information and help them decide who has access and who doesn't. And then, of course, a governance table that wants to make decisions is only as strong as its control over that data. You need to make sure there's not a porous system where information is flowing all which ways, and that's where the protections comes in. And I'm not going to stay too much on this just right now. I encourage questions. I encourage the report is on our website. But there are these three areas that people would, after I followed all of these organizations along, and I started to think, well, there's kind of a groupings of work that are happening. The first one was around, yes, that organizational readiness piece, but that looked differently here. And that meant hiring people, of course, who have the perspectives necessary to delve into this. Yes, this is data. Yes, this is health, but also this is community work and this is equity, right? And how do those things come together? And are you resourcing those positions? Because we found organizations that had, the resources dedicated to teams to do this, and they weren't doing it at the side of their desk. They saw more success in this space. And then also looking at how an organization makes decisions, their strategic plans, their board objectives, weekly meetings, like how do managers, in their day-to-day operations make decisions for their teams? So being able to go into that and put EGAP at the center of this all, we saw the better that they were able to do this, the better they could, actually manifest this. So it requires you to actually explore within, right? And build that internal readiness by just asking the right questions and inserting yourself or inserting EGAP into all these spaces. And then also part of this was preparing for challenging perspectives, or, I don't want to say resistance. That sounds a bit too active, but sometimes people have some very pointed questions about this. Some are from fear, from places that, are maybe not as good intention, but others are actually people who have, again, the experiences we're talking about, and they have these questions. So just be prepared for those, create spaces for those. Don't be afraid, right? Negativity is not always a bad thing. You need to include those perspectives in your conversation to move forward as a group. And then we also saw the part of the technological infrastructure and how important it was then to have to explore and understand how data moves in your organization, right? If you insert race-based data in a certain platform, how does that move, right? Who's in charge of that? And then being able to explore what you can toy around with and what you can't, right? And then when you get to a point that you're like, I can't make any changes here, then start exploring vendors, start exploring other teams. And that's what people did, right? And they actually found success in being able to collect race-based data and make some very specific decisions around it. And the last piece is collaboration. So both within an organization, a coalition they're building, and having them be both people, at the very top, leaders, executive sponsors, but also people who are actually doing this work every day, actually understand how this works. So you need to include them in the conversation and what's going to happen. Being able to structure that and document that and not just have it be this, up in the air things that are happening off on the side, that's what's really going to create change. And that guide is there, and I'm happy to, engage with questions beyond. I also wanted to talk about another piece of work that we've done, which is with the City of Toronto. I started working on a Black community data governance framework as well. So the city has now lots of different data sets. before we were focusing specifically on health, but now we're talking about community safety. We're talking about housing and shelters. We're talking about children's services, employment services. And there's a commitment to using sociodemographic data to address inequities. So now we need to think about what does this framework then, or EGAP, look like for Black communities with the city of Toronto. And we did a literature review. We consulted with communities many times. We talked with lawyers and tech experts. We did a scan within the city manager's office, clerk's office. There's so many different pieces. And we brought them together to this final framework that you see here that we developed at the end of the year. And to kind of, again, at a very high level, go over it, you see these principles, which are the parts that everyone said were very important to see throughout the work. One, that data is used for progress. It's not a static thing that gets lost. That there is accountability in place for every single decision. They understand who to go to, and transparency. And this first objective, or you see these objectives here, and these are kind of almost areas of work that people all talked about. The first one being that the city empowers communities to govern their own data, right? To make decisions around it. And you'll notice EGAP, EGAP is still in there, right? To align with kind of the broader work that's happening in the sector. So again, building relationships with community and building spaces essentially where data is now talked about with communities and you're making those decisions together, and the city has that relationship. Objective 2, slightly nuanced now here, is in discovering the different ways that data is managed. Well, if you have a group of people from communities saying, we want data managed in this way, but we don't really understand how that moves throughout the city or how decisions are made, or it's made in so many different ways, well, we need to get our house in order. And that's what that second objective is about, building some responsibility and roles around data governance and community data governance specifically. Understanding the architecture, right? The data or infrastructure around how that operates and moves in the city, so that when you hear a new perspective and you want to make a change, that's actually put in place and you can engage with the data environment. And the last one is just building standards around agreements and those sorts of things, so that within the city, there are less silos and people can help each other have those documents in place so you're not reinventing the wheel. And the last one being that now that you have the community perspective and you have your house in order, let's move forward. Let's put this data into action. And that's what that change management, that first piece is all about, right? In those day-to-day operations, what does change look like? Control, how are you going to manage all the different data sets in the city and actually influence the way that they are, both withheld or pushed forward. And then of course, using it. And then that's what would lead to these 3 outcomes here about building trust with communities, centering Black voices in decision-making, and data is used for good of Black communities. And just what's happening this year is we're working with the city to figure out an actual implementation plan, right? Enough frameworks, again and again and again, who's responsible for what piece, how are we going to move forward? And that's what we're currently working on. And the last thing I'll talk about just very quickly is what's happening as a country. And that's something that we've also been working on at the Wellesley Institute. So we heard last year that there are little pockets of race-based data collected at different organizations, federally and provincially. And what I just started to do was just find emails on websites. I found phone numbers and started calling people. And I just said, hey, are you open to a conversation? I'm just curious about what you're doing. And it got to the point where we started contacting enough of these organizations where they would be telling us things, and maybe we would pass information to another place, say, maybe we can connect these you two. And it got to the point that it was too difficult to just constantly be this, dial zero operator. It was, let's all just get in a room. Let's all just talk. So we got some of these, we learned about these initiatives. We heard about in Nova Scotia, they started collecting race-based data, via the health card. That was one approach. We heard in Manitoba through, their hospital centers that they were going to be collecting, race, ethnicity, and Indigenous identifiers at, primary care or hospital settings, sorry. And we knew in BC that they were starting a demographic survey so that they could use that to link that to all of the different data holdings that BC Stats has for them to use, so that they can actually understand the equity impact across the board. And so we were asked, we brought this space together. We said, okay, well, let's build some consensus. Let's all get on the same page and move in the same direction, right? That's what we need to do. And so this is just a list. This is not all of it, right? This is just a quick list of some of the organizations that we have here. And you can see across the country that there are, both federal organizations. We have about, 5 or 6 different provinces in our group so far. And it's just purely based on interest. People want to come, we allow them to come. It's really what it is. And in the May, that's the link that was just sent. We had a summit where we brought some of these people together to present their work, and they talked about it, and there's some exchange of ideas. And in that link, you're able actually to see the slides of all the different presenters that were there. So if you're curious about how race-based data is actually being implemented and the governance as well, people spoke to governance, how that's happening, feel free to look there. And I'm also open to a conversation, of course. And so in summary, there's lots of work that's happening around sociodemographic data and race-based data, how that can be used to improve health. And then also thinking about what community data governance looks like, and now how that can benefit Canada. There's work that's happening here in the health sector at the City of Toronto and also across the country. And these are very practical things that are being implemented right now. And so I would just encourage everyone to, dive into these works a bit more, make some connections. That's also what we try and do at Wellesley, is we try and just listen to people, hear what they're trying to do, and connect them to the right person. So that's what I have to say, at least for now. Thank you so much for allowing me to speak. What I'm going to do is I'm going to turn it over to Emily.
Hi, everyone. My name is Emily Akerman. Thanks so much, Jamal, for handing it over and for your very, very interesting presentation. Yeah, I'm going to be talking a little bit about data for equity at the City of Toronto. As mentioned, I'm a consultant working in the equity unit, which is kind of working now with the data for equity unit as well. So yeah, we're going to go talk about our strategy a little bit first. So data for equity, when we're talking about these terms, and we use this a lot at the city, but it's not necessarily something that you currently see everywhere, or that is something that we find is very understood in terms of, what kind of language we're using consistently. So just to kind of preface the conversation, when we're talking about data for equity, we are really referring to the use of disaggregated data, so data that is collected and then broken down by sociodemographic group identities, that we can then use to really understand community experiences. We can use it to identify equity and prosperity goals or gaps, and develop more just more useful, really, and more beneficial programs and policies that serve residents a lot more equitably, particularly First Nations, First Nations, Inuit, and Métis, Black and equity deserving community members. And it also helps us monitor the progress, so track sort of goals that we have, those outcomes like Jamal was talking about, how are we actually seeing that we're tracking this progress, how are we actually getting there? So data for equity can help us do that and assess those impacts that we're having. So the City of Toronto, for a while, worked on this sort of data for equity strategy. So all about using sociodemographic data to kind of do all of these different things that we just mentioned. And eventually, once the strategy was kind of complete, it went to the City of Toronto's City Council in November of 2020 and was adopted. So since 2020, we've been kind of working to implement the different phases, if you will, of this strategy and kind of really do this work. The City of Toronto is a huge organization. There's roughly 40,000 staff. There's 50 or so divisions that we are trying to implement this work through. So it's not easy. It's not a quick and easy sort of process. And as Jamal knows as well, with the Black data governance strategy, it is the framework you have, but then like you said, the implementation is, that piece where we're trying to really make movement. So it's been since 2020 that we've been implementing this, and I'll go to the next slide. And basically how we got here to, actually getting this strategy approved by City Council to where we are today is basically that we made the strategy because ultimately we saw a barrier, and that is very much well known. I think community has been telling us this for a very long time, right? That there is absolutely, without a doubt, barriers and systemic discrimination that impact First Nations, Inuit, Métis, Black, and equity deserving community members that are residents and people that just use our services in general. And that's ultimately impacting their, opportunities and outcomes in their lives. So with that, we ultimately need an approach that helps us to amplify, understand, and identify all those different barriers, and in a really informed way where we have evidence, we have data, and then that allows, our decision makers in the city to really make those informed decisions rather than, basing things off of assumptions or off of, potentially even just like outdated research or anything like that, right? So we want consistently collected, up-to-date information that can help make our decisions. And so what we did with that need was essentially create this strategy, start implementing this strategy over the last 4 years, which has been enabling these, kind of gave authorization, if you will, to certain divisions at the city to collect and use consistent and high quality sociodemographic data and disaggregate that data so that we can really understand community experiences. And we have, of course, we have our healthcare area, but we also have, like Jamal was saying, we have a lot of different services. We have shelters, we have housing, we have long-term care, we have children's services, all these different areas that we really desperately do need to understand, who's using these services, who's not using these services, what are the gaps, what are the needs, and it comes to what we already offer, how can we improve these services so that the impacts of the services are much more equitable and actually meeting the needs of such a diverse community in Toronto. So we've been implementing this strategy for the last 4 years. And basically, we have these 5 core principles that are guiding us through this implementation. And those are equity and human rights, open data, privacy and security, First Nations, Inuit, and Métis data governance, as well as Black data governance. And so we're obviously working closely with Jamal's team for the principle number 5. Roxy, who's next, will tell you a little bit about number 4 there. And then we've talked a little bit about privacy, security, open data, things like that. This is really all regarding making sure that, within these, very significant changes, pardon me, that we're trying to make to this current system of how we collect and use data, we need to make sure that we are ultimately respecting the privacy and security of our residents, of the service users. But in particularly, like I think Jamal was getting to, right, is like in a way that actually matters to them, is meaningful to them, and is also transparent to them so that our residents actually understand, their rights and what is happening with their information once, it's collected. We don't want it to just be like that. We've taken it and then you don't know what's going on. So we have talked also a lot about accountability, transparency, those type of principles too, right? And that all comes down to equity and human rights, where, we ultimately have human rights to a lot of this information we have. It's very equitable to do this. So that's what's guiding us. And so the objectives of First Nations, Inuit, and Métis data governance, the strategic framework, as well as the Black data governance framework, are to really have these communities own, as well as analyze and report their own data away from the colonial institution, which is the City of Toronto, the government here. So, and that happens really through these 3 objectives that we have, which is initiation, collaboration, and then a framework. So we're kind of right now in that initiation and collaboration area. We're not trying to rush into this. We have some interim sort of, resources and things available right now while we're kind of in this process, but we're not trying to rush this. We really want this to be an informed, co-created, collaborative sort of process that we're initiating. So we will, continue working on these objectives. And so with that, I'm going to let Roxanne Gillis dive into some more of the details of this strategic framework here. She has been leading this work, very, very difficult work. So I'll give Roxy, you need your moment here.
Thanks so much, Gichi, Emily.
Glitch.
So just do a quick little introduction of myself. I'm Almashkago Cree from Treaty 9 Territory, Fort Albany First Nation, and my dad's Punjabi. My mom's Cree, my dad's Punjabi. So just as Emily was talking about, during COVID, as part of a quick background, the City of Toronto had received various types of data, mainly disaggregated data, sociodemographic data. Although given the unique harmful legal and historical background of FNIM data usage, such as the residential schools, when FNIM children were experimented on for health reasons and data was collected, the City of Toronto recognized the need to interact with FNIM data distinctly. Some of those barriers, which like an up-to-date example would be the birth alerts in the province, which ended, I believe, around 2020. And my family personally had suffered from these types of interactions with institutionalized forms of oppression, which was in 2014 when my mother had my little sister. So FNIM data is sacred information and aligns with basic human rights, thus leading to this collective decision to mitigate further harm by developing an FNIM data governance strategy. Before we begin anything, and understanding data governance from a First Nation Inuit perspective and Métis perspective, we need to understand the historical implications, which the present day challenges faced by FNIM people surrounding data. And we need to analyze the histories of that. Ask ourselves questions such as, how old is Canada? What happened prior to the Confederation of Canada? How did the treaties develop? What nations are in alignment with the areas that we live in? What history was taught to me about Canada and FNIM peoples and nations? And by asking ourselves these types of questions, we open ourselves up to understanding the political, legal, cultural, and traditional differences and learning new perspectives. Cultural differences in governance. So epistemologically, which basically means how do we know what we know and the methods of justified belief, and ontologically, which means the basic understanding of our existence, First Nations, Inuit, and Métis peoples govern themselves within a relational aspect, meaning everything is habitually circular and can relate to one another, similar to an ecosystem. No one is above nor below. So each person, animal, living entity, even the tree nations, have gifts, which supports our existence. So we preserve, protect, and care. And a book I would recommend if you want to learn more about this, it would be It's All About the Land by Gerald Taiki Alfred and The Medicine Wheel for the Planet by Jennifer Grenz. So the image on the left is linked from the paper, quote, exploring how Indigenous healing practices in a Western treatment model seeking safety can coexist in assisting Indigenous peoples to heal from trauma and addiction by T.N. Marsh. So Western epistemological and ontological understandings of the world are, for the most part, embedded in hierarchy, man versus nature and control. So this operates in a hierarchical bureaucratic governance structure. And decisions are made through a centralized authority with power often concentrated in the hands of a few individuals. For example, governors, monarchs, or appointed officials. Typically, this looks like a triangle or a top-down approach. The process of treaty making between the Crown and FNIM identifying communities was often involved in coercion and significant language barriers. These treaties resulted in displacement of FNIM peoples from fertile, resource-rich lands to less productive areas. Displacement alongside misused treaty terms resulted in unresolved land rights and ongoing disputes. A book I would recommend reading to understand how these acts took place is The Making of Treaty 9 by John S. Long. So currently, data collection and governance practices are critically influenced by these histories of dispossession and mistrust. The data related to land, resources, and demographics were historically gathered without consent or permission from FNIM peoples and nations. This led to significant gaps in data, as well as data that does not accurately reflect the lived realities and needs of FNIM peoples. Historical data was utilized to seize land and resources, creating further marginalization of FNIM peoples and communities. So Section 35 of the Constitution recognizes and affirms Aboriginal and treaty rights of Indigenous peoples of Canada. Although the lack of clear evidence of land surrender and the misuse of treaty terms generated ongoing issues of interpretations and enforcement of Canadian law and rules onto FNIM peoples. A present-day example of this with myself is when discussing MFIPA, people in government assume that MFIPA is applicable to any and all nations, not understanding that there are treaties and operating nations currently existing with their own laws, even if they differ from nation to nation. Section 35 addresses the need for data sovereignty. FNIM peoples and communities must have control over how data related to their lands, resources, and peoples is gathered, managed, stored, used, and shared. This is a critical step to ensuring that our FNIM rights are being upheld in a manner consistent with cultural and traditional practices and governance systems. The image is from John Burroughs on the left-hand side, John Burroughs' blog on revitalizing Canada's Indigenous Constitution. So UN Declaration should cause courts to reject freezing of Aboriginal rights at, quote, magic moment of European contact, end quote. And the original painting is by Norval Morrisseau, called The Masterpiece, which was created in 1982. The United Nations Declaration on Rights of Indigenous Peoples supports the argument of FNIM data sovereignty. UNDRIP explicitly affirms the rights of Indigenous peoples to maintain and strengthen distinct political, economic, social, and cultural institutions through our engagement with experts. We have heard that regardless if the province has implemented UNDRIP, we can still move forward as it is an international customary law, meaning customary law is a law that refers to international obligations arising from established state practices, as opposed to obligations arising from formal written agreements. So customary law is considered binding in all states, whether or not they have signed an agreement between provinces, nations, etc. This reflects a general practice accepted as law under opinio juris. The image above is from the Arctic Institute article, Canada's Acceptance of the United Nations Declaration on the Rights of Indigenous Peoples, Implications for the Inuit, the Arctic Institute, Center for Circumpolar Security Studies. Original photo is by Bauman. It's important to reflect on what works and what doesn't. Unfortunately, strategic methods are restrictive, harmful, and create and perpetuate the objectification of FNIM peoples. So as we move forward on the path to this concept of reconciliation, we have to again start asking ourselves questions such as, what does reconciliation actually mean to FNIM peoples? How can we allow FNIM peoples to lead the visualization of walking in two worlds? What do FNIM peoples want? And how, as public service workers, can we make that happen? Colonial practices have and are counterproductive to reconciliation. They fail to honor various governance systems, cultures, and traditions that FNIM peoples have maintained for tens of thousands of years. Reconciliation cannot be done through a top-down approach, which continues the power imbalances. This means we must recognize that true concepts of reconciliation requires First Nation, Inuit, and Métis leadership. We must be at the forefront of this work, leading, guiding, and utilizing our own nation's ways of governing. That also means respecting the nations as nations, because the Crown has a duty to consult, and that's our job now, like myself or Emily. With this in mind, there's 4 key components that arose from this work. Trust and power dynamics, and how do we build up those relations? That takes time. I feel like oftentimes in governance, we tend to rush out the relationship building aspect, but we need to look at the history before we can understand the present. 2, collaboration. Collaboration also means a nation-to-nation engagement approach. 3, diversity of communities. And understanding, especially as Toronto is quite diverse with First Nation, Inuit, and Métis peoples from various different nations, we need to be mindful of that. And what does that mean when we are looking at identity? We have not clarified that concept as of yet, but it is currently in the works. And 4, iteration, constantly evolving to the needs of FNIM peoples. Practical steps moving forward. We're currently in the information gathering stage. So this requires also relationship building, which I mentioned. And that began last year when I started the position in July. I am a First Nations woman living in Toronto. I do have some history there. I'm a guest to that land. It's recognizing my own positionality when I'm moving forward with this type of work. So we spent about from July to December trying to understand the complexity of the work. By January 2024, we understood the approach that structurally was taking place was not working. So we worked as a team to make things happen and to ensure that we were carefully working within the terms of FNIM, urban peoples, organizations, and nations. Currently, we are gathering our thoughts together. Since this is new work, we must always remember our positionality in these spaces as public service workers, because I think oftentimes we forget that it's our job to serve the public. And we need our leaders to stand with us on this type of work. This is a nation-to-nation rebuilding initiative. So for the time being, we developed an interim guiding document with principles, things that we have heard from last year's consultations and some of this year's to ensure that we are not continuously causing harm. So this is not an exhaustive list of resources, but it can support learning about FNIM data governance, as well as understanding the lens that we are on. Yeah, Kichi Miigwech for letting me speak today. And if you have any further questions, you can contact the Data for Equity Unit, myself, or Tinika. And I'll be passing it off to Christian.
Thank you, Roxanne. Wonderful. I love the discussion about reflecting on the history of Indigenous people prior to colonization, and to the ideas that guide the way that we do our work that are inconsistent with sort of Western ways of thinking. So I'm going to start off by being thankful to my co-presenters, to Public Health Ontario, to Tahira, to my organization for giving me the opportunity to work in this field, to the Public Health Foundation division that I'm part of, and I think most importantly to the team, the Health Equity and Indigenous Reconciliation team that I'm very blessed to be part of. And so I'm going to start off by trying to tell you some stories. And also, I'll start off by telling what the main intention of this section of the presentation is about, what I'm hoping to do. So my hope is to encourage all those that are listening that if you haven't started already, to start taking action, to collect data, information, stories, in partnership with the people that you want to support to live healthier lives. My hope is that the stories that I'm going to share are going to demonstrate the importance of nurturing good relationship, which is both the engine and the fuel for effective equity action and data governance. Frameworks and models can be useful, and this is my own bias, it can be useful, but they're hard to action. I believe for the average person, they're hard to action because they're abstract and devoid of all real life situations and human details that give them meaning. So sharing stories through relationship, on the other hand, is the fundamental human mechanism for sharing data, for imbuing that data with meaning. So one of the purposes of sharing stories is to provide us with a mental roadmap or for what to do when faced with challenges. Now, be it to avoid, or to overcome dangers in the wilderness, or how to overcome modern threats such as inequity or social injustice. So hopefully the stories that I'm going to tell you about how we've collected data at MLHU will help you, give you a bit of a roadmap of how to begin to think about governance of that data. So I'm going to start my story by giving you a little bit of context. Like most stories, you need to know a little bit about the setup for the story. The Middlesex on the Health Unit is located geographically in an area that's currently in proximity to the Oneida of the Thames First Nation, the Chippewas of the Thames First Nation, the Munsee Delaware Nation. It's also located in a space where there are many Indigenous organizations such as SOHAC, ALOSA, Family Healing Services, and NAMARIN. We also have a lot of members of the African, Caribbean, and Black communities that live within our geographic area. And we are fortunate to have two foundational documents, the Taking Action for Reconciliation Plan and the Anti-Black Racism Plan. Both of these documents were commissioned several years back to guide our organization on how to engage in anti-oppressive, anti-colonial equity practice specific to those groups. And they were commissioned they were created by members of those communities. And they're full of many recommendations, wonderful recommendations, many of them very aspirational, which is great. But it also makes it very hard to sometimes understand how do we begin the work. Between the two of them, there's over 100 different recommendations on how to do the work well. So what was important for us is to understand one of the things that we are lucky to have and very privileged to have is the organization has invested in doing this work. So there's a team, which I am part of, the Health Equity and Reconciliation team. We call it HEART, which is responsible to implement the TAFR, ABRP, as two primary goals, but also to just work with the organization overall to advance the standard of equity. And we do that very much in collaboration with two other teams, our epidemiological team and also our strategic planning and performance team. Now, when we were thinking about this work, we began to try to figure out where we could do, implement all the many different categories of recommendations that were there. But, the health equity team was really drawn to recommendation number 1, for example, in the ABRP, which is the collection of race-based data. And it literally, I think I'm paraphrasing, but it says, the MOH will collect race-based data. And that is it. And there's multiple other recommendations, but I knew what a great place to start, because I knew that self-reflection and understanding gaps of equity need to start by collecting information. And it's also aligned with our Board of Health strategic goals. So it is wonderful that at the Board of Health level, there was a commitment made several years back to start collecting that data and to use it. And so what our vision is, and our vision continues to change as we learn more, and we do that in collaboration with our partners and future partners, is to increase our organizational and staff capacity to collect race-based data and sociodemographic data to achieve client-centered and culturally humble approaches to that data collection, to increase organizational capacity to utilize race-based data and sociodemographic data to identify health inequity and share it with partners for collective action to reduce inequities. And even those, when I read them now, are not quite true to the way that we're doing work, because it's not a transactional way that we're doing this work. It's very much a partnership work. And so even I realize that our vision may need to be modified in the very near future, because it doesn't quite reflect the reality of how we do the work. But the story hopefully will illustrate this. So I'm going to tell you now the first of the stories, and this is the more technical and boring story, at least from my perspective, is that a while back we began to, because of those fundamental plans, began to plan for the collection of race-based data. We knew it was important for population health assessment. To meet all our standards in public health, we had to do this work. So we spent a long time in 2022 preparing for that in the Public Health Foundation's division teams. We had lots of different things that we could ask around demographic questions, but we wanted to focus on those 2 prior populations, Black communities and Indigenous communities. We have relationship with them, so we decided to narrow that down and ask 2 questions about identity, Indigenous identity question, and a race-based question. As I said, the planning involved a lot of internal partners and external partners. And when there wasn't partnership, we had to build that partnership. We began by training staff, preparing everything that we needed to do in June of 2023. We got a lot of, we created the infrastructure for this project to move forward. And then we quickly moved to start collecting data between July and September of 2023 with 4 pilot teams. Again, with the idea that we realized how complex this all was going to be earlier in our planning. And we decided to, instead of trying to change all of MOH, just only prioritize parts of the organization. And we learned a lot. Now, this is not very interesting. And I'm going to move on to a story that to me is where data governance started, and really the back story for that sort of technical story that you just heard. When I started this job, and I came from mental health, the mental health sector, I'm new to public health. Principles of co-creation, of social determinants of health, of equity are things that I have worked with in my past with equity deserving communities, with people like myself that have come from other places in the world, people, parts of the Americas where colonialism has an impact. I'm here because of colonialism. And so it's sort of full circle that I wanted to give back to communities. And one of the things that I always start off is by trying to meet people. As a psychotherapist, by training, I know that I have to understand, be centered in the person that I'm going to try to help, to be able to decide even if they need my help, right? They may need no help whatsoever. So I reached out to those health centers at the First Nations that I mentioned earlier. And one of the first things that I did is to bring them into a meeting to start talking about how we could work together. They had told me through those conversations that they were really proud of the work that we had done together during COVID-19, in the response to COVID-19, to the pandemic, because we had to come together and we collaborated and responded together. The health centers are also public health agencies for their own nations. And so we had common mandates and we did great work together. And they wanted to continue to grow that. So they came and visited us at our facilities. And in a meeting with with a group of colleagues from one of those nations, I found out that one of our colleagues was not happy with the relationship. That after COVID, all that great work we'd done in sharing information and co-creating had diminished. And maybe there were some excuses we could have put forward that, our organization had to redeploy staff. Many people, there was a lot of turnover. And what happened for about a year or so after the pandemic, that communication stopped. And so the relationship wasn't being nurtured. And this person was very brave to just directly, with a lot of anger and frustration, tell us that what happened to the information that we used to get from you? What happened to this person that used to reach out to me on a regular basis? And as I said, my predecessor and my team had left the organization. There was a new middle officer of health. Everybody had been sort of done these musical chairs things, but those were excuses. I immediately had started to apologize for that experience. I reached out to the medical officer for health. He took it also, Dr. Alex Summers, took it very seriously, and we immediately took action. So what we see there, data was already being shared through that engagement process. And we heard the gap about relationship, about engagement, and we took action immediately. We began to meet regularly with all the health center leadership and council members within those nations to reestablish our common goals. And one of the wonderful things that they said to us is that what was most important as a priority was to build relationship, not creating MOUs about how data was going to be shared, or that the technical pieces of the work wasn't as important as just making sure that we build relationship. So we began to do that. And since those initial meetings in January of 2022, we have continued to meet very regularly, bi-weekly, once a month, and with lots of connection in between. And so again, the human story behind that history of how we collect the data is that it was relationship, a trustworthy relation was the primary mechanism for data to start to flow. All those collaboration meetings have led to things like how we decided to pick the 4 teams: the infectious disease team, the sexual health team, the healthy children team, and the vaccination teams were chosen because those health centers needed information about those pieces of work to be able to collaborate with us. So it wasn't by chance or by theory that we decided to go in a certain direction. Also, we have an advisory committee for the implementation of the anti-Black racism plan. It's called and it's made up of members of the various communities that are, Black, Caribbean, and African. And again, from the very beginning, from 2022, we have meeting with them regularly to speak about the data collection, their aspirations for what they want the data to tell them, and how we're going to govern that data together, or how we're going to use it for the benefit of their communities. So in both cases, the relationship came first. Now, I'll tell you, just for the sake of completing the story, is that we have collected lots of data so far. We piloted, but we continue to collect data. And then what we found, as Jamal was saying earlier, is that there is no concerns usually from the community in responding to this question. Over 90%, and we're now monitoring this on a quarterly basis through a KPI, of clients that are asked will respond. And recently, we're getting close to 100% client response rate. Now, where we need to continue to grow is that, at least during the pilot, our staff participation rate was at 70%. So that how often did they actually have time to ask the question when they could have asked the question? And there's a variety of reasons why sometimes staff, like being very busy, are able to ask the question. But our benchmark is 100%. We want every opportunity when possible, or it's safe for the client for them to ask. And we're going to continue. We know that those are moving in the right direction. Our target right now is 80%, but we want to be able to have enough data to be able to use it, right? And to then eventually connect it to outcome data so that we can say, here's where the equity gaps are on health for this particular partner. And now I'm going to get to some lessons learned from all that work that we've done, with lots of relationship building, lots of ongoing challenges throughout this. It's not been easy by any means. It has been very complex, and the complexity of it all has made us doubt, getting started at times. But it is wonderful that at every level of our organization, we have reminded ourselves that we have to start. Inequity continues to grow, so there's no waiting for the right time or for the right framework let's get started and figure it out together with everybody that's involved. So you have to build yourself time. I think I would say that we may have moved too quickly at times for the sake of action. But what we've learned is that sometimes we had to slow down. There was resistance for good reasons. Things were unclear how they were going to move forward. People had fears about how it would impact their work, the relationships they had. And so we had to pause. So I would say in general, the one thing we'll learn is that we need to give ourselves more time to ensure that every partner or potential partner, person of interest, is involved and understands the implications to their own lives. So we can only move at the speed of trust, would be the underlying message there. And courage, perseverance, and support are needed to overcome inevitable fears and resistance. There will always be lots of fear behind like, how is this information going to be used? I think when you do it through a relationship, that fear is diminished significantly because there's a lot of transparency about how we're doing things together, the processes we're going to use together to collect the data, analyze the data. And I put there in brackets a team. You need a dedicated team like the Health Equity and Reconciliation team to be able to do that work. Teams like the EPI team members being allocated to this project at MLHU, that the evaluation or strategic planning and performance team were allocated to the team. Without having allocated resources, it is very hard for people to try to do this off the side of the desk. It's actually, I think it's not really possible, and it cannot be done well. As I was saying, there's no template of how to do it right. So you do need to think about your own context, learn a lot, ask a lot of questions, read as many frameworks as you can and put them in your head, but then get started and figure out where it makes sense with the people that you're going to do the work with. And what I would say, because we do live in hierarchical organizations, right? Senior leadership is important because when you hit those roadblocks or when you need resources, you need people with the current power to be able to allocate those resources to continue to encourage the organization to move in the direction that you need to go. Now, hopefully what we're trying to do is transform that so that it's the collective that provides that power for the work to be done. But for now, in the current systems that we work, you do need that hierarchical support to get moving. And as I was saying, engagement and relationship are crucial to sustainability. I mean, it's at the beginning, after the beginning, in the middle, after the middle, at the end, and it just continues in a circular fashion, right? There's never a point where relationship isn't going to be the driver of this work. And governance then becomes the data is being used by people, for people, with their full understanding of how it's being used. Now, we're getting to the place now where we're starting to work on things like policy, procedure, frameworks, but they come after we understand how to do the work. And I mentioned earlier on that we also, accountability is important. So creating mechanisms for the data to be monitored and so that we can hold each other accountable to the targets that we've set for one another is crucial. We're very lucky at MLHU that the collection of race-based data has become a KPI of our performance management system. And what's next? That we do hope when we have enough data, we're going to be able to connect, and our EPI team is beginning to figure that out, how that information is going to be connected to our health outcome data so that we can find those equity gaps so we can take action together. Now, some of that is already happening through conversations with our partners. What's wonderful about this work is that the data is coming in and we're having conversations about it. We don't have to wait for a report to know what we need to do together with First Nations partners, for example. We're going to modify and develop current protocols and procedures with those partners, right? Because we have things that were existing before, and now that we're learning how to do that work in collaboration, we're going to have to begin to modify that and document how those things are being modified. And as I was saying, we're going to formalize those governance expectations. We have, bodies like the ABRP Advisory Committee that came, that were recruited to advise us on how to implement the ABRP plan, but not necessarily to govern data. So now we're in the process of talking to them about, do they become a part of that system, that structure of governance? Do we need to create a different group? Same thing, the Indigenous Health Center partners came to do work related to their mandate, not necessarily to govern data. But again, we're talking to them about what do we need to do to create infrastructure, policy, procedure to codify those expectations. And I think something that we're also going to have to sort out is formalizing the process for analyzing that data. As I was telling you right now, I think analysis or meaning for the data is being generated as we do the work together. But we hope, again, to document that process so it's clear how decisions are made, how information is going to be interpreted in the future. And I believe that is the end of my presentation. And I'm going to hand it back to Tahira.
Thank you so much, Christian, and thank you everyone for your rich presentations, from historical context to striking that balance of relationship building with moving things along on the technical end. I think that our attendees, and I know I for sure, have definitely learned a lot. So we're going to move now to the Q&A session to address some of the audience's questions. Please continue to enter your questions into the Q&A pod if you haven't already done so already. And we will be going slightly over today to about 1:20 to accommodate the number of questions that we've received so far. So just to begin, we had a question around striking a balance on the collection of voices in this work. So how did you go about striking the right balance of organizational representation and independent community members in the community data governance process? And I know each of you are in different stages and different pieces of work along this spectrum, but would love to hear from each of you on how this has rolled out within your organizations on striking the balance of representation. So maybe I'll start with Jamal and then pass it over to Roxanne and Emily.
Sure. Yeah. Happy to, again, speak to my perspective of this based on the work that I do. I think this is a question that comes up every time, which means it's important, right? My perspective on it, though, is I think sometimes we focus on getting it all right, and I think we need to sometimes think about what's the good thing to do in this moment, reframe it all, because there's lots of things that we do need to do, right? That's why we care and we want to, we're in this space. But first, before we even get into the people that are involved, we need to think for ourselves, are we doing a good thing by doing this? And then in that way, you start to feel affirmed by what you're doing and the impact of your actions, because then you start to see a benefit, regardless of how big, small. If you want to quantify it in any which way, good change is good change, rather than thinking about it being right. So when it comes now into the balance between organizational representation and independent community members, I think the basis of that question is, right, that we understand that not everyone can be connected to an organization, but we still want those people to be involved in the process. And to that I say, there are already so many spaces where communities gather and talk about things. And it's just a matter of starting an engagement. And this is what I mean by doing a good thing. A good thing would just be to reach out and start and do something small and just hear about that information. The right thing to do would be invest all your resources in and engage with everyone, right? But we're focusing on doing good right now. And in that way, you're naturally going to have organizations involved, because as many of our institutions are places that maybe not necessarily have direct relationships with communities. And so we need to make sure that we're doing it safely. And so you're going to go through those channels. And I know I even didn't really answer that question. I didn't say, well, it's a 50-50 thing between organizations and people, or 80-20. And it's hard to say that because, again, this is what's the important part about starting and engaging with community at large, is that that number is going to change depending on the month that it is, and also thinking about the neighborhood that you're in. There's some places that are really engaged with communities and have leaders in place at organizations, other ones not so much. But what I would encourage everyone to do is not worry so much about, do we have all the right voices in, because everyone's voice is actually a right voice to be there. We need to focus again on the good voices. Do these organizations, do they have a good reputation in community, right? Are they safe spaces that people already draw towards, or lean towards for support? And in that way, you'll find out about the people along the way. And that's what I've seen happen. And so I hope, in saying what I said and to close it off, that we kind of start to almost, I get it, these issues are very stressful because they're very real, right? They're tangible and affecting the livelihoods of many people. And sometimes you can take that on and really think, again, I need to do this perfectly. But if you are in that space and you understand that you are committed to the goal, make the decisions that you can and push in the places you can to make good, to make a good impact. And then through that way, I think you're going to feel better about what I do. And also you're going to motivate others to be involved. And in that way, have a broader reach within community, right? Because you're not saying that you're going to fix it all through this initiative. You're saying, I'm just trying to do a good thing. Do you want to be involved? Yes or no? Or, how could that be possible? And in that way, you invite a better spirit. So I didn't answer the question, but more redirected it to try and think about something else. And again, that's just my perspective.
Thanks so much. That was a really great perspective. Roxanne, Emily, anything you wanted to add to that?
Yeah. Similar to what Jamal just said, there is no such thing as right. I think that I'm always going to go back to that governance process, understanding the differences in nations, understanding the differences in governance practices. Like right now in Toronto, we have to understand the location. We have to understand, okay, it's Treaty 13, it's Mississaugas of the Credit. How are our relationships there? And then we think about, okay, the diversity of FNIM peoples within that jurisdiction of Toronto. Okay, what are the overlapping nations? Then we have to ask ourselves the question of treaty or non-treaty, status, non-status. So we always have to go back to that crown relation and then that Indigenous way of doing things. Indigenous is typically a term that's utilized on a global scale. For this particular framework, we have to look at the legal context of things because data is technically legal. It's a very political movement, and it's all across Canada that it's happening. So that means that we need to situate ourselves. We have to look at those governance processes. We have to understand who we are in those spaces. And so in the practices that we have done, I always think about lived experience. Now, what is lived experience? Who can constitute what lived experience is, and from what lens? I think for myself, like I'm a human trafficking survivor, I always put myself back into like those spaces, and it's traumatizing. It feels like sometimes we have to re-traumatize ourselves in order to understand what's happening around us and how those things are going to inform things that have affected us in the past. Like I've had my own interactions, for example, with the city of Toronto. I've had my own interactions with trying to access services and my information being collected and incorrectly collected by the city of Toronto staff members. So I think about those experiences and I think about, okay, what and who and how are those voices going to impact and address the concerns that have been brought forward by people I know, people that work in those spaces as well. So yeah, I go back to those governance processes. I go back to understanding the legal aspect of how this is going to be impacted, because that's kind of where our barriers are. So balance is going to be difficult, but balance I find is also a colonial perspective.
Thanks so much, Roxanne. Emily, anything to add to that?
I think my colleagues here definitely wrap that up pretty good. I totally agree. Just don't let perfect get in the way of good. Make sure that you are taking action and doing your best, and that's ultimately what we're capable of doing right now. There's no such thing as perfect in these spaces. So and making sure that your staff are people with lived experience, like Roxy was even just saying, people with lived experience, they'll have those relationships and those insights into what they think is the right balance in terms of, you know, who's participating and who's trusted, like y'all were saying. So I think those are important. But that's it, yeah.
Absolutely. Thanks so much, Emily. In the spirit of getting to some more questions, I'm going to open up another one here. And it's around the notion of community ownership. So when we're talking about community ownership of data, what does that mean? Does it mean that community organizations are holding the data, or that public health units or primary health centers are sharing that data with community organizations? And what does that sharing look like? And so maybe, Christian, I'll start with you on this one, and then we can pass it around.
That's, ownership is a concept that I've been thinking a lot about recently, and it's something that we really have to try to challenge, because I do think that things like copyright, etc. There's a lot of ownership that has been used by, this is my opinion, Western societies to control and to create inequity. Information doesn't belongs to everybody. It's how human beings have thrived through millennia, because we in communities shared information about both our aspirations and the troubles that we solve problems together. Information shouldn't really be owned by any one person. So I think things like jurisdiction get in the way of sharing data. We've had to figure out how to jurisdictionally share data with First Nations health centers, federal, provincial. Those are things that are literally just somebody's idea of what's right and what's wrong. So I think beginning to tactfully, politically astutely challenge that. But I think what's key is that if you involve people, if you let them participate in decision making through some way or another, eventually they are they're governing the information with you. They are sharing the information with you. What you have to do, because we live in a place with legislation and laws, etc., that we eventually have to document it, put it into policy, etc. But I think it's important not to get caught up on what the current rules say about how things should be governed or owned.
Thanks so much, Christian. And I believe, Roxanne, you have something to add from your perspective as well.
Yeah. So I was told nicely, in a very nice way, not to focus on ownership, but that's exactly what I did. So I said, okay, I want to take a look at what exactly that means. So I was told, look at access and control right now. Now, when we're told not to do something, that typically means, okay, there's something obviously there that hasn't been deconstructed or understood. So in that process of that research, and that's academically speaking, there's a long history of, again, legalities that control identity, because ownership is tied to identity. And so the Crown relations to the Indian Act, for example, the white paper, all of these forms of wanting to control our identity is also a form of data colonialism present day. So that means that information that we have, the gathering, the storing, this also ties into IT. So where is the physical form of storing this information going to be? So if, let's say, from a legal standpoint, the information does not belong to our institutions such as municipalities, provinces, the federal government. It doesn't belong to the Crown. Where then do we store that information? There's a practicality behind that then. Okay, so then we need to look at, well, what's already out there? And currently, the FNIGC, they are working with the federal government. They received some funding to develop those data hubs. And hopefully, if you get the chance, you can talk to the FNIGC. I believe it's Aaron Corson, but you get a chance to talk to people that work at the FNIGC, and you can see what kind of data hub information that they may have. So there's a potential possibility of creating MOUs, because then they can hold that information for those nations as those nations rebuild themselves, because we have suffered so much colonization. We still are rebuilding ourselves. Residential schools closed in 1996. That's not that long ago. I was born 1993. I'm 31. Like that, it's really not that long ago. So there's a lot of nation rebuilding initiatives happening. And so as we begin to understand these restructuring of nations, we also need to do our job and then educate ourselves internally when it comes to these crown relations and these indigenous relations. And I guess in terms of concept of ownership, yeah.
Thank you so much, Roxanne. I know that there's so much interest in this topic, and I really wanted to thank you all, Jamal, Emily, Roxanne, Christian, for presenting. I wanted to thank everyone who's joined us today. There's been so much interaction in the Q&A pod. And to access this presentation and past presentations, please visit the PHO website, head to Education and Events, and click on Presentations. Thank you so much again, everyone, and wishing you all a wonderful day and a wonderful week ahead.
Thank you.